All right, you guys, let me go back to the beginning of my slides. Don't, stare too carefully here at all the things that I've got going on. But I'm so happy that you've joined me. I'm really excited about this topic. Can you guys hear me okay? Let me just make sure that you're able to hear me, because I know sometimes it gets a little bit muffled if I don't have the microphone really close to my face. So I'll try to do that and make sure you guys can hear what I'm saying, because this is going to be really exciting. I, as you know, love talking to people about getting their bodies healthy, that we truly believe that the bodies are designed to self-heal, to self-regulate, to be able to live our best lives. And there's often times that there's something interfering with the process and we don't necessarily know what it is, or we might just not be aware of what it is. So we are going to talk about something really new that I haven't necessarily brought to the office completely, because this is also very new science that we're talking about. The book that I had just read that just really integrates all of the neuroscience that I've been reading and just put a beautiful bow on things. It was just published last year. So it's pretty new, and it's changing our neuroscience books and neuroimmunology. It's called The Angel and the Assassin, amongst other books that I've been reading by neurobiologists that really talk about the brain and talk about the interconnectedness of the body. So not a lot of us understand how the immune system, how the gut, how inflammation affects our brain, because it's very different than how it affects our body. And in turn, how we're having all sorts of neuroimmune issues, neurodevelopmental diagnoses, and neurodegenerative conditions that are going on, including early onset Alzheimer's, which is really kind of scary. I sat through a seminar where they chatted with us about all sorts of brain things that are going on, but knowing that the average age for a woman is 52 for early onset Alzheimer's. So ways to keep your brain on par, our moods really well. And I'm just going to help you guys kind of understand exactly what's going on and how our brains work. That's how I work, is to understand the why before I can understand what to do and then how to do it. So we're going to go through that with you and really talk about the interconnectedness that we have inside of our bodies. And when I had first started looking at this book, there was a scientist in there who in the early 2000s, so like 2003 to 2007, was looking at the brain and knew that he had a very connected, mind and body. And he was trying to find what was going on. And, if he felt sick, also his mind wasn't well. And then vice versa. When his mind wasn't feeling well, his stomach wasn't feeling well. So he knew that there was a connection. He was trying to prove it. And what he had done is taken the T4 cells, so important immune cells, out of mice, out of their bodies, and they were unable to learn those paths of the maze, all the things that they do with mice. And then when he added it back in, they learned again. And he brought this to the neuroscience platform, and he brought it to their conferences and started showing his research and showing his products. And he was laughed off the stage. And now they know exactly what he's talking about, that this has all been coming into fruition. They are changing our neuroscience books and knowing that there is an immune system inside of our brain. There is tiny lymphatic flow inside of our meninges of our brain. But we're really going to talk about how this then affects the rest of our body, because we don't really understand necessarily saying, oh, okay, I can see that I don't feel well, but my mood's also off, or I can't remember things, or my child's struggling with learning, or maybe you're struggling with battling emotions, with anxiety, with depression. And we're going to just kind of break that all down, and then also give you a really broad view first of health and understand what we're looking at before we get down to those nitty-gritty cells. So really what we're going to help you guys start dissecting is how the brain works, because we know the brain's in control. We know that it is in constant communication with our external environment, with our internal environment, and it's got to get information to it in order to decide how to orchestrate the rest of the body. at the rate of 300 trillion bits of information every second. We're consciously aware of 50. If you've heard me talk, I've probably said that statistic before, but it's something that is just really wildly important to understand, because often we think we can outsmart or outwit, or our conscious mind can outthink our subconscious and all of our autonomic nervous system processes, and it really can't. So we're going to talk about how that brain gets its response, and then what it really is doing to the brain, because inflammation inside the brain looks very different than inflammation inside of the body and the immune system. So Dr. Mario Bruce, I do like that man too. Dr. Bruce Lipton is also a highly awarded scientist. He did a bunch of research with stem cells. He wrote The Biology of Belief, The Wisdom of Your Cells. And he was the one who was able to look at environmental factors that were turning on genes. So epigenetics, rather than, you were dealt this hand or these genes, and now good luck. This is just how it is. You have a genetic disposition for something. Instead of understanding we can actually turn these genes on and off. He also did a bunch of work with stem cells and looking at how they work. And one of the things he talks about is our body is really just a large community working together. It's 50 to 70 trillion cells that are all doing their job, orchestrating information going in and around our body. They all have very different jobs in this community, but when things are in balance and everyone's doing their part and there's no stress, then we're in homeostasis. We're in balance. Our body feels good. When there's stress in the community, when there's a fire somewhere where some areas aren't acting up or are acting up and aren't acting well, and there's some troublemakers, our body should typically find those troublemakers, flag them for death, right? They're put in the jail cells. And actually in this case in your body, they're taken out. They're saying you aren't working well, you aren't functioning well, you aren't, basically participating in society like we like you to, you need to go. And this community that we're going to look at inside of our body, that orchestration all has to happen through your brain and your nervous system. So we're going to look at ways where we start finding some areas of our bodies, organs, glands, mind, immune system that starts overreacting and constantly thinks that there's stress or a fire there, whether there is or whether there isn't. So this is going to be kind of fun when we start chatting about all the ways that we probably don't know our brain's being affected and how it's being wired. So, and even looking way back into childhood, and for some of us, this might be really refreshing, being like, oh my gosh, okay, I understand what I can do to start to heal, and that this is very a validating thing. As we go throughout here, we're going to talk about mood and depression and your body's ability to be able to handle different stressors and how that shapes and forms. And for some people, it's very I think really nice for them to be able to hear and be validated of their feelings, because somebody that's dealing with sensory issues, their senses really are turned on, and they are turned on high. Somebody that's having anxiety or panic or depression, that's really how their brain is feeling and reacting. And now we can look inside the brain and see exactly what's happening to those neural connections. So I think it's so exciting. So as we look at what stress does to our body, it does start to put that community into a little bit of chaos, and sometimes a lot of chaos, and it becomes a perpetual cycle. So when we start breaking down further, okay, how is the brain responding? We've got two different modes of operation inside of that nervous system. We have our stress sympathetic mode, and then we have our rest, heal, digest parasympathetic mode. And we're going to talk about this even more so as we go along on how this is affecting our body. But all of us know about the fight or flight response. If you've heard me talk about it before or heard a single webinar, we're constantly talking about that fight or flight response. That is great. It's inborn. It's innate. It keeps us alive, but it shouldn't be on all the time. And, if 2020's kind of showed us anything, it's been a cyclical stress response for sure. And a lot of us needs healing and repairing from that. And then our parasympathetic nervous system is where we learn while we're sleeping. So in parasympathetic is when our body, that becomes activated when our body is asleep. And that's when we are learning. That's where we are getting more brain activity, more neural integrations while our eyes are close. And they found that out when they were training rats, for their mazes, and they had forgot to take off the electrodes off the brain while the rats were resting, while they were actually sleeping. And they watched their brains go back through the maze at a slower rate, but that was integrating those neural patterns. So parasympathetic, we're going to chat about this a little bit more, is really, really important. So it's okay to experience stress, although we're going to talk about what this is doing to us. But what it isn't okay to do is to be stuck there, to be stuck in fight or flight. And what happens when our body experiences stress, actually show you this first little picture that we can look at that's going to be really important a little bit later as well, is how inversely proportional these two systems are. When our body is under stress, when it feels fight or flight, we have got a complete opposite effect in the parasympathetic versus the sympathetic nervous system. It does the exact opposite to those organs and glands. So we can't be in both at the same time. And when our body is stuck in that stress cycle is when we see this stress response turned on, and this immune system that we're talking about that starts those interconnected either build up or tear down inside of our brain start to be activated. So what happens, I'm going to give this really great example that I like to give to my patients, and then we're going to chat even more about the process. But when your body feels a threat, and this might be, it's your perception, it's your nervous system, it's how you're living, it's how your brain's been orchestrated, and it's often been trained from early on. It's how you react to a stressor. So for you, you might say, oh, my body sees this as a threat. As for other people, they might not see that as a threat to them. Their emotional state says, no, that's not stressful. But for other people, it is, and vice versa. So if there's a threat in front of you, that innate response of the sympathetic nervous system is to turn on. And for your senses to turn up, it's got to survive, it's got to fight, it's got to flee, it has to pay attention to what's going on. So all of our senses are turned up. As you saw in that last slide, we're talking about dilation of the pupils, hearing, tactile, our skin, our movement and proprioception, our balance. So we're going to talk about how important that is in a little bit. And our digestion is turned down. What we do is shunt our energy from this internal organ and gland structure where we're at balance and homeostasis, and we bring the energy out to our limbs to fight or flee. And that's where it needs to be until the threat is gone, and it'll be robbed. That energy of your internal organs are robbed. Our immune system is going to turn down. However, our inflammation is going to go up because it is ready for attack. It's ready to be injured. When there's a threat in front of you, there's a good possibility of you being injured. So that inflammatory response is going to go up so it can heal really quickly. Well, unfortunately, if we start getting stuck in that fight or flight response, we also start getting stuck in that inflammatory response, and it becomes a perpetual cycle. And we're going to talk about how to stop that, because I'm sure that's one thing you guys are thinking, well, I need to stop. Along with a lot of the other things we're seeing in our society, which is high heart rate and high blood pressure. Because when you're under fight or flight, that heart rate's going to go up, that blood pressure is going to go up, and your body is going to be looking for its ability to respond to that stress and maintain that high level of output. Well, we only need that for a short amount of time. And somebody that can't calm down, that can't come out of fight or flight, is going to have a sustainable high heart rate that can't calm. And then we've got a whole epidemic of heart disease and high blood pressure and all those things right now. But we also become very emotionally impulsive and reactive. So we can all picture somebody that is stuck in fight or flight, or we can see somebody who, maybe you've startled, or you see someone that's angry, and you see all those effects happen from red face and everything's tight, and you're in this protected mode. And what happens, and we're going to chat more about the brain, but the brain reacts as well. And the brain goes from having a lid on. So the front of your brain, where my forefingers are, we're going to use that for your prefrontal cortex, or your lid. This is what really makes us human, is this prefrontal cortex. It's responsible for executive functioning. And what happens when that lid is flipped, the amygdala takes over, your hindbrain. That's the impulsive and reactive side of the brain. And that's what's making you be a crazy person, right? You were like, I can't calm down. I can't handle this stressor. And then when you start adding one more piece and you're like, oh, I can't stand it. So we want to know how your body's responding to stress. We want to know if you've been feeding that stress cycle. And we look back throughout our life to say, okay, guess what? Small emotional stressors can add up. Physical emotional stressors can add up. And it can be one big one, like, 2020, or it can be all sorts of little ones, or even early childhood trauma that will all start to add in to the stress inside of our nervous system. And as chiropractors, we look at this as being out of sync. You're out of homeostasis. It's not disease, usually not yet, but it's dyshyphonease. The body's not at ease. The community inside is not at ease. And what feeds that cycle over and over and over again, it begins this process are what we call the 3 T's: physical, chemical, and emotional stress. And they're going to feed that fight or flight response and cause inflammation, irritation, interference, and subluxation. That word in the middle is really where that stress has been stuck. And what we know is that, fortunately or unfortunately, our nervous system never forgets. So when you think about, a sensation of, oh my goodness, I smelled apple pie and my grandma used to make apple pie, and I'll take you back to grandma's. But there's also those stressful trauma situations where your nervous system hasn't forgotten what happened to you when XYZ had occurred. And one of my favorite stories that I will often share with patients is a friend of mine who had to have some surgery, some pretty major abdominal surgery. And the last time her body was under and needed surgical intervention was when she was delivering her son, and he lost his heartbeat while she was delivering. And that turned into, we're putting you under, we lost the heartbeat. This is an emergency. And thank God, was able to resuscitate him after 15 minutes, and he lived. When she came out of this second anesthesia with this abdominal surgery, she wasn't quite all there yet, but her nervous system went back to that moment, and she started just like hysteria, saying, where's my baby? Did he live? Do you know if he's okay? Is he alive? And the nurse is thinking, like, this lady, like, what the heck just happened here? She had a baby. She thinks she had a baby. The nurse is terrified, but it was her nervous system going back to that time. And it's all stored in there. So one thing that we like to do is break that cycle of stress and let our bodies, instead of hanging on to stress and letting it bog us down and get that community all disrupted, is to let that stress go, adapt to that stress, and be more adaptable to things that happen. Because, exercise is stress. We're stressing our body. The biggest thing it needs to do is go back into parasympathetic to heal and repair and learn. So we're really into making sure that brain and that body can fully communicate, and it's clear, it's concise, it's healthy. But we also have to consider what has happened throughout our lifetimes, and are we feeding this stress response? Because many of us can look at this and say, yes, I had a ton of chemical stress as a child. I've got a bunch of emotional stress right now, and the physical stressor, we might have accidents, falling off our bicycles or in a car accident, but really a huge physical stressor in our life right now is not moving our bodies enough. We are sitting at computers, we're having our head down on cell phones, we're sitting at desks all day, as our children are. Or we're sitting at desks all day as office workers. There's technology, which really encompasses all of these 3 T's. They looked at a lot of research with social media in this book, and they could even predict the amount of time spent on social media relating to the amount or the degree of anxiety and depression in teen girls. And it was if they spent 5 or more hours, they had 70% chance of developing anxiety or depression, which is really heartbreaking, because that our teens are on their social media platforms on the regular, and it just really needs to be limited, because it's really affecting some of those early connections. So what we know about the brain and how it is able to respond and how it's being wired, we're going to rewind time a little bit and look back at how the brain is developed. Yes, our body was made from 2 cells into 50 to 70 trillion.
which is an amazing innate response and an innate intelligence that we have no capacity to fully understand what's going on. But what will happen is the brain starts to develop and starts to grow in the second trimester is rapid brain development and growth, which we can chat a little bit if there's some trauma during the pregnancy. But when they start moving their body is when the brain starts getting fed and integrated. That's why it's really important, even in utero, that the baby's able to move. Anytime we see, there's intrauterine growth restraint, that baby is out. They know that brain's going to stop developing. It has to move and it has to get feedback. It's like a battery that gets charged through our movement, but it also gets integrated. It's largely mechanoreceptor driven and integrating right and left sides of the brain through movement. So when our kids are little and they start, holding up their heads and sitting up on their own and then crawling and walking, all of those motor milestones matter because we know if they're on track, the brain's on track. Well, it still matters throughout growth and development as we start sending the signals up, cross over near that brainstem, and start integrating the right and left sides of the brain. So they can talk. I've got a slide on here in a little bit that shows us just exactly what the right and left sides of the brain does. And that integration to be able to talk is really, really important. So we measure that kinesthetic movement to the brain because we know this is a huge piece into feeding the brain. So we need to know that development is on par. And then now, even as adults, that movement is there. So we're charging the brain so it can do all of the things it needs to do. Those 300 trillion bits of information is shooting back out every second, that those messages are clear, they're concise. It wants to do the best it can with what it's been given, and we've got to look at what we're giving it. And they've looked at research with children where they have had unpredictable stress during their childhood and the way that the body is responding, because what we're trying to do is develop that prefrontal cortex, that lid on our sympathetic nervous system. When a baby is first developing in utero, up to about 32 weeks, the only thing developing is the sympathetic nervous system. Then after 32 weeks, parasympathetic starts taking over. That's when there's rapid organ and gland growth. This prefrontal cortex won't be fully developed until, later 20s for men, mid 20s for women. But that part of our brain that makes us human and keeps our lid on and opposes that fight or flight response, that prefrontal cortex is responsible for a lot of things. I've got a slide here in a little bit. So when there's unpredictable stress and the body is perpetuating that dis-ease cycle, you start to see interruptions there, and you start to see interruptions in how the brain is developing. And we'll often even see a hippocampus, which is responsible for memory, responsible for mood, be atrophied. So we're going to talk about how exactly that happens, and also environmental toxins. There's I think since the 50s, there's been 80,000 different chemicals released into our environment that haven't been tested on the human body, haven't been tested on the brain, and they haven't been tested on the immune system. So our body does feel like it's under constant attack. I'll show you that slide here in a little bit as well. Here's some of the progression that we'll start to see with early brain development. I've already mentioned a couple things if there was stressors during the pregnancy. Sometimes when I'm talking to moms that have a child that's struggling with sensory or mood or behavior or anxiety or neurodevelopmental issues, there was something really stressful during the birth, whether mom was sick or encountered some sort of bacteria or was vaccinated or had experienced some sort of loss, emotional loss. We've had parents die or someone diagnosed with cancer. It's big emotional components. And when that sympathetic nervous system is the only thing developing and we're feeding that cycle, we'll start to kind of set the stage for a baby to feel like they're under fight or flight as well. I had to learn this the hard way just with myself moving to Idaho, sight unseen, in 2008, didn't have a friend, single friend or family around, opened a business and was pregnant, not knowing that stress, all the hormones I was feeling, all of the stress response I was feeling was going to the baby, and kind of set his stage and really changed our lives and on how we deal with patients and why we do this neuro based care. But to see how his brain was developed compared to the one that I was in school, loving life, learning lots of things, they're very different people. And it can be personality, but it's also when I look at their neurological scans, how their body and their nervous system was responding. birth injuries, that goes in that trauma category. There's a lot of kids, births that are forced out, Pitocin. There's often, doctors that can't wait saying, you've got this time frame, or we're taking them out, or we should schedule them on this day, or your pelvis is too small, we need a cesarean section, and there's an upper cervical injury during the birth process as we pull them out of the birth canal and treat them as we never would after they were out of the birth canal, because that's the one thing we do is protect their head and neck, right? We're like, protect the head and neck. We would never jerk it around and let it fall because we know they don't have motor control yet. They haven't touched gravity. That side of their brain hasn't been integrated and is unable to, especially when we're talking about that brain stem and where those signals are passing over to the right and the left side of the brain. And then as this continues to progress, we'll often see stress, colicky babies, ones that don't sleep very well. They're stuck in that fight or flight response. They don't feel good. The only way they can tell you is through crying. And now they're upright. Now they're trying to use that motor integration. Maybe they've crawled, maybe they haven't, maybe it was a short period of time. Maybe they, crawled for a really long time and were unable to walk until a little bit later, or they started at like 9 months. You're like, oh yeah, my baby's up and running at 9 months. And you're like, when we've got a stiff spine and nervous system, it's easy to be erect. We don't want that. We want a nice, organized spine. It should be a C spine when they're born. They shouldn't be rigid. Then they start holding up their head and neck, developing their cervical curve, their mid back. And as they start standing is when you develop that lower back curvature and the gait and the hip capsules and all the things that need the pressure and the walking. If you guys have heard any of my motor development, motor milestones webinar, we chat about that. They'll start to be that terrible 2s turn into terrible 3s. Sometimes they'll get an ear infection because they're not able to drain their ears because they've had that upper cervical damage. And a baby that's been stuck in fight or flight turns into a toddler, turns into a kid who's been stuck there, and a teenager who gets angry and depressed. And we're going to watch this process in the brain and how this happens. And then adult that's just stressed out, burned out, fatigued. And I'd like to add a number 8, which I should, and it becomes an aged adult that has neurodegeneration. They can't remember things. They've got early onset Alzheimer's. They've got a brain and immune system that can't remove the damage. They've got a brain and immune system that's overactive and clipping off too many pathways all along in their lifespan. So this next slide, when we're looking at what that's doing to the system, what that progression of stress starts to do is changing our senses, like we talked about a few slides over, but it's also really changing that motor input into the brain. And I know many of us look at senses as having 5. I think they're up to like 10, but the ones that we pay attention to really closely is also our enteric sense. So how we feel inside. How did something make me feel? That made me feel stressed, that made me feel anxious, that made me feel sad, because often we will disassociate feelings with the body. And that comes later on in life, especially through this process where they'll say, this part of your brain is saying you should be sad, but your motor cortex is saying don't care. And those are people that have lost compassion. Or there's your gut is screaming, I can't digest this, but your brain says, eat it anyway. That's your enteric sense of how is my brain and body connected and how am I feeling inside? And is my brain able and capable of handling those stressors? Or just even like the emotional response, there's many of them that will miss out and say, you should be feeling, this should make you feel good, but that side of the brain is also understimulated and saying, this isn't a positive experience for me. And those are kids that are kind of like, or even patients, people. I say kids all the time because that's what I deal with, but adults as well, where it's just that pessimistic, that didn't make me feel good, where you're like, how are you not happy? How are you not excited? How are you looking at the glass half empty side of it? Well, that's a lot of that internal brain development adding up over time, but also how the integration of the brain is happening. And then that proprioception. So where are you at in time and space? How is that brain getting that motor movement? Is it developing appropriately? Do you have good spatial awareness of where your body parts are? Because what will happen is if a child hasn't had it, or even we start to lose that sense of stability as an adult and lose awareness of where our bodies are, we're fall risk, we're a balance, that's when you can imagine somebody that's elderly kind of bent and hunched over, that little shuffling gait that they're doing, because their brain has lost proprioception and orientation and movement from the body to know where it's at, so it's protecting. And as an adult, people that don't have a good brain-body connection and that motor sense are also damaging tissue because their body doesn't know exactly where that foot or that ankle or that knee or that glute is at, and it can wear and tear on those joints as well. Oh, so here's my little prefrontal cortex slide. I knew I had it coming up here and what it does. So as we're giving proprioception back to the brain, as we're getting that movement, as we're crossing over, as we're developing those two hemispheres together and developing that prefrontal cortex that does executive planning, motor functioning, decision-making, problem-making, helping you control yourself, opposing that fight or flight response, and also helping you have long-term goals, right? Like goal setting, feeling positive, knowing like, this is what I want to do. This is pre-planned motion. And when we start to see a prefrontal cortex that's not being engaged well, that's not wiring and firing together the way we want it, because, we say something called nerves that fire together, wire together. Well, children birth to 3 are making 1 million new neurological connections a second. It starts to slow down, but it is rapid until about 10, slows down a little bit in those teenage years, but I'm talking millions a second. And then even in our adult years, we're still making, at least in our 30s and 40s, 1 million new neurological connections in a year. So yes, it slows down, but if we're just firing stress after stress after stress, we start perpetuating that fight or flight response. We get really tired, we get exhausted, we get fatigued, we have inflammation in our brain, which I'm going to chat about here. I know you guys are waiting for it. And that starts deteriorating those pathways and mood and emotion. And you'll start to see all of these other things. There's not normal movement, sensory perception and intelligence has been altered. And we start experiencing lower executive functioning, personality changes, abnormal emotional responses, and general difficulty for some people just to live their lives, to get out of bed, to go into a grocery store, to feel safe and comfortable with those around them. And that can be, a really fast progression because we have kids that are like that. And then we can also have it where we've kind of developed it into our adult lives saying, I can't handle that level of stress anymore. And it's because the body's not in balance. That community inside of our body is chaos that's been there for so long. There's so many errors. There's so many people not getting the right signal from central command to say what to do appropriately. And there's a lot of errors that start occurring despite our best efforts and despite, what we've been doing to try to heal. So you can even look here at this picture. I found this was my favorite photo I found online, just talking about what the right and the left side of the brains are doing. We need them to talk, if you remember. So one side of the brain might be saying, I'm feeling sad, and the other side says, I don't care. We need those integrated so we can respond appropriately, not only to motor movement, to emotions, but also to just healing our bodies in general and how we feel inside. All of those senses and enteric response and that parasympathetic nervous system that needs to run the show and help heal and repair and integrate the brain while you are sleeping. Let me move this down here for a second. Okay, so I know I've been talking about tearing down pathways. I know I've been talking about the body and the brain and how it works. And a lot of these newer discoveries, how I said before, even just 15, 20 years ago, we didn't think the immune system, and we said there's no lymphatic tissue in the brain. We said the immune system wasn't inside of the brain. And instead, just recently, like I said, this book was published last year, but some of these scientific discoveries have just started happening rapidly. And in 2017, so less than 5 years old, where they really started to see what's going on inside the brain. And those tiny little brain cells that can be angels or assassins are called the microglia. And they were white blood cells. 9 days gestation, they travel up to the brain via your vagus nerve, which we're going to chat about here in a little bit. And they turn into the immune system of the brain. And their job is to travel around and check on everyone. They are there to do some horticulture. So if anybody has experienced apples or cherry orchards, you know that you're clipping off branches so other ones can do what they need to do. So for the health of the whole entire tree, for the health of the colony, that's kind of what the microglia are doing. We used to think I keep saying science didn't know what microglia did. They were very unglamorous when I was in chiropractic school learning about the brain. They were just a cell in the brain. And now we know it. They actually travel around the brain, knocking on the door saying, is everybody okay here? Do we need to change anything? And they can do one of two things. They can secrete a pro-inflammatory response and cytokines that are attacking and tearing down pathways, or they can be building up new motor pathways and integrating more and keeping the health of those pathways there. So it can be an angel or it can be an assassin. And what we know is this immune response in this microglia, because they're designed to check on the health of the brain, when the brain constantly feels under attack, these microglia are going to start to get overactive. They're going to start snipping off pathways that don't need to be snipped off. We're going to start to see brain firing and neurological wiring for stress, and in areas of our body that should be building up, like emotional responses, are now getting wired for fight or flight, that lit off approach. And they found it very overactive in the hippocampus, which is responsible for mood and memory, which is a lot of what we see today. You know, one of the number one things people bring not only themselves, but their kids in for is their behavioral response, their inability to sit still, their inability to learn, their inability to, feel comfortable in their own skin. And when you start looking at the stressors in their lives, a lot of this starts to make sense. And what the microglia used to be able to do was to attack a pathogen. I'm going to move on to my next slide here. So when you're looking at the immune system and the gut response, your immune system knows what to do when there is a pathogen there. It is a biologically natural process for our body to experience a virus, to experience a pathogen, to have bacteria enter our body. We have an immune system that can respond to that. What it's not able to do or keep up with are those 80,000 chemicals that have been released into our atmosphere. And it doesn't know. Those are chemically made in a lab. The microglia thinks it's under constant attack. And the more of the chemical exposure that we have, the more overactive they become. And they think they're under attack, and then start adding in an emotional component to it, adding in social media, adding in not moving your body enough. And now we have this perpetual cycle of stress, and I should say a brain-gut connection, which we're going to look at here in a little bit, that is also sending an inflammatory response to the brain. Once again, typically because of chemicals, but also a diet poor in nutrition and inefficient with oversupply of chemicals in them, typically an inefficient nutrition supply, and our brain and body can't quite keep up with all of that it's been bombarded with at a really fast rate. And I really do feel like the technology piece of it has played a huge role in the emotional component. But if we're not paying attention to the environmental factors that are around us and chemicals, which we can't always do, we can leave our bodies really, really vulnerable. I've done an immune webinar, but I want to briefly explain how the immune system works and how it can be activated and underactivated or overactivated. Your immune system has two different modes of operation, just like that nervous system that we talked about. You got your fight or flight, you got your parasympathetic. In your immune system, you have your Th1 and you have your Th2. And that Th1 we call the firefighters. Those are the ones that have a very generic response to a pathogen that's come inside of our body. That is fever, inflammation, heat, vomiting, diarrhea, coughing, mucus, pus. It's all those things to say something got in, get it out. It needs to go. And then we have a Th2 system that is our inspector that comes in and says, all right, what caused the damage? What's going on? Okay, we need to make an army. We need to make memory T cells to this army of whatever virus came in. We need to know next time if it gets in, you guys are fighting those guys. And what happens is often we start turning down the Th1 response. We're afraid of fevers. We're afraid of germs. We're afraid of diarrhea, coughing, vomiting, right? We are running from that right now and saying, oh my gosh, turn it off, give them a drug, don't let it happen, antihistamine, anti-diarrhea, antivirals, antibacterial. We are shutting down that response. And in turn, we're having more pathogens come across that system undetected because that Th1 has been dampened so often, time and time again. Now your Th2 that makes those specific immunities start becoming overactive. And we all know what an overactive immune system starts to do. Autoimmune. It starts attacking our own tissue, much like that microglia, where it is overactive, not knowing who's a friend or who's a foe, who should I clip off, what is this chemical, I don't know what's happening, I don't like this neural integration that's coming together, because we should be in survival, we should be defending ourselves, rather than we should find balance and homeostasis. So we have a long ways to go, even that I saw, through 2020, to allow our bodies to get ill with a natural thing, not a man-made or a chemical thing, for our bodies to go through a sickness. We are very virophobes around here. We used to have normal childhood illnesses. Everybody got measles, mumps, rubella. We built up this strong immune system. We were able to pass that on through our placenta to our babies. And instead, we're sending them straight into the bloodstream and letting the Th2 system respond. So we've traded a lot of childhood illnesses for asthma, allergies, overactive immune systems, and a very high over-functioning Th2 and a low-functioning Th1. And now we'll see either, somebody say, I never get a fever, or my kid doesn't ever get sick. Well, that might not be a good thing, because it might mean your body's not responding and are allowed to respond to the viruses that are entering. And when they're there for too long, that's what cancer is. And we've got obviously a society really battling that, not only the chemicals, but shutting off that immune response and not trusting our innate response to heal from that. It knows what to do. And what had used to happen, back in the day, is you'd get sick, you'd get a fever, you'd let it run its course, you'd go to bed because you don't really feel good, and you obviously still stay hydrated, but you kind of stay away from the rest of the community that you're with, because you're not going to spread it around to everybody all the time. Now instead, we've got these systems that aren't even recognizing that they're ill, and a brain that feels like it's under constant attack. So inflammation inside of the brain doesn't look like red hot, like it does inside of the body. Instead, it looks like overactive microglia. It looks like an atrophied hippocampus, underactivated motor cortex, which is the movement side. When our bodies are fatigued and lethargic, we typically have too many of those motor pathways clipped off from the microglia, saying, I'm too tired to do that, I don't want to move. Because when you've got that sickness response, your body's saying, you rest, you stay here, and it keeps you unmotivated. And that's part of, a lot of fatigue and depression that we're seeing as well. And we'll often see right and left sides of the brain activated differently, including the left prefrontal cortex. And that can often be a mood disorder as well. And our vagus nerve tone is really low. So your vagus nerve is part of that gut-brain connection. So when I circled all the way back to the parasympathetic, and we saw all of what the sympathetic nervous system did and the parasympathetic, much of that control, let me see if I can go all the way back here without getting you guys ill. staring at this. Here we go. When you go all the way back and you see the neural connections, there's a ton over here on that sympathetic nervous system that's coming from your central nervous system. And then the one that's running the calming response, the healing response, it's largely connected in the brain, if you can see right there. And one of the biggest ones, this guy right here, is your vagus nerve. That's when people start talking about the brain-gut connection, they're talking about the vagus nerve. But we also know when the vagus nerve is being restricted because it's unable to be stimulated, or because there's actually damage in the upper cervical spine, which, by the way, is also part of your blood-brain barrier. Over half of it's here at that brainstem. We'll see that vagus nerve that doesn't get to be utilized, and it's undertoned and it's understimulated. And for those of you who are patients, that's part of this scan that we're looking at over here, where we're saying, okay, are you stuck in fight or flight? Is it taking over? Or is your vagus nerve have enough tone to it? You would be balanced. Or is your body tired and fatigued and stuck over here in parasympathetic? Because once again, you should only be there at night. And then over time, are we losing our capability to handle and manage stress and a battery charge on the rest of our autonomic nervous system? So that's through HRV, and that's what we're looking at when we're getting that scan. And over here, our EMG is that neuromotor input to the brain. How integrated is the brain? How well is it being fed? How organized is it? How efficient is it? Is it able to integrate the right and left side of the brain? And as you know, we focus really closely on that upper cervical, near the brainstem, near the relay system. He's air traffic control, near the exit of that vagus nerve that comes out right next to that upper first cervical vertebra. Is that all operating the way that it should, or is there chaos? Is it understimulated? And the coolest thing that we found is under chiropractic care and under neural-based chiropractic care, when you're getting an adjustment, you're sending that feedback to the brain. We used to think you're kind of affecting that level of the spine, right? You're clearing up the communication there. And instead, when they hooked people to electrodes and they delivered those adjustments, it's just affecting our lid, our prefrontal cortex. It's called the N30 wave. That's what it's affecting. It's affecting your brain's ability to be a human, helping integrate the body, helping us calm down, helping us inhibit that fight or flight response, helping us with executive function to be able to say, hey, something else is going on here that I need to respond to. Hey, an area needs healing. Hey, there's chaos in the community. I need to put this fire out. And the more stress that's been there, the more time that's going to take. And there's people who might be like, oh man, I'm beyond that kind of help. I'm just dealing with a wackadoo here, right? I mean, I've had people come in and say, my husband is completely crazy. He goes on these angry fits. I'm afraid of him. I have to leave the house when he's there. My children can't be around. There's some people that are like, chiropractic care is definitely going to help. But there is a deep ingrained neuroatrophy that's got to be inside of that brain for a human to respond that way, to be so angry, to be so reactive, and to not be able to manage and handle themselves. It doesn't just flip overnight. There is an entire process that starts to occur there. Oh, here's my little slide about that vagus nerve and all the things that it does, and that it really is that nerve that it, that immune system travels up, but that's going to integrate all the organs and glands and that body-brain connection that we so need and is so important and part of calming our body down. Often we'll have patients make sure that they're belly breathing. So remember when I told you when you're under stress and you shunt the energy out to the limbs to fight or flee, and you become very protective, and that heart rate's high and the blood pressure is high, you're breathing with your chest and up here, the breath becomes very shallow. It becomes really stressed. Even once again, during exercise, that will happen, but you've got to recover from it. To help calm your body down, you feel in your belly, you start filling your belly with air, you start pulling down that diaphragm, you start calming the body, and it starts to stimulate that vagus nerve as well, and also bring your body down to a sense of calm. That's part of what meditation does as well. So we often recommend that to patients. We definitely, want you to evaluate your life and say, okay, what are my 3 T's? What can I actually help and eliminate? Because there's a lot of things saying, okay, I can't take that out. I can't avoid this, can't avoid avoid that? What can I do to help my body not get triggered over and over for fight or flight? What can I do to make sure that I'm not, overstimulating that immune system? I should have put that on there, is to be sure you allow your body to experience what it needs to experience. Don't be afraid. Don't be the virophobe, afraid of sickness all the time, unless you've got some sort of crazy autoimmune or, immune system disorder. Allow your body to build up over time and be able to catch up to that overstimulated Th2 system and make a balance there as well, so you don't have that chronic body inflammation, brain inflammation, and immune system that's overrunning and able to start to accumulate more and more autoimmune. Finding that outlet for stress. So the movement, your brain needs movement. It needs to be fed. It's a battery. Find some exercise plan, find a yoga plan, find something you can do to stimulate your brain, because it needs to be charged and it needs to be fed in order to do its job. Finding things to do for your parasympathetic nervous system, like I talked about with belly breathing, Epsom salt baths, essential oils, things to calm your body down, maybe some meditation before bed. And look and see, what can I do to calm myself, especially to be able to match whatever stress I had for the day. Some of us may have had a fine day and you're like, well, to match my stress, I don't need a lot of help. But there might be a day where you're like, this was crazy. That's when you're going to really need to, to integrate something into your life to combat whatever stress you experience during the day, even if it's to bed earlier, so your parasympathetic nervous system can run the show to heal. And for those of you who aren't patients, I know when I looked at the registration, there's about 50-50 of people that are patients and who aren't patients. I would say get a neuroscan, figure out how their brain's responding, figure out how their motor system is being integrated into their brain, figure out if they're stuck in fight or flight. And I have one other scan that looks at inflammation inside of the body to see, okay, do we have an overstimulated inflammatory response happening as well? What's the health of the organs and glands? And that's also part of our three-part scan that we run to see how's the brain and the body communicating. What course of care do they need? Let's look back through their case history to say, okay, here's their 3 T's. Here's when they occurred. Here's how the body's responding currently. This is what we do. This is the kind of plan. This is how many times we need to stimulate that prefrontal cortex to get that lid engaged, and then allow enough time with it engaged for the body to heal and repair and restore itself. So on every one of my webinars I have on here, I think we have like almost 30 or 40 now, because COVID had me do a lot of webinars instead of in-person events. We have a new patient VIP pass, and that offer should be on there. Typically our neuro scans, if somebody comes in with just off the streets, they're $189. If somebody comes in with a very complicated case, those are $300. For watching my webinars and getting pre-educated, those are $100. So I encourage you to take advantage of that, take that offer. And if there's somebody else in your family saying, okay, I need to see what's going on in their nervous system, let's do that as well, and make sure that you guys are living your best life, your highest life experience, because I truly believe that we're all put here for a purpose, and to serve that purpose, we have to be our best selves. Thanks for watching. Oh, I did it in under an hour. Appreciate you guys.